seconds. We're just going to give everyone a chance to get into. So this is Jonathan. It looks like we have people coming into the room right now. We're expecting a pretty big crowd, and it is just 1 o'clock here Pacific time. And I want to start with thanking you guys all for coming. I'm going to start a little slow on this introduction because people are toggling in. We're up to 100 people already, and we're going to get going really quick here. But I just want to make sure that everyone has a chance to join us in the room. And we're at 160. Once we pass 200, we'll just go ahead and start right into it. Super excited about today. I had the pleasure of meeting Paul Yuan. Both professionally, he was representing a buyer and doing some due diligence as they purchased a practice that I was brokering. So I'm a practice broker, and Paul Yuan was working on the buyer's side to help the buyer do some due diligence and some analysis for the practice. I've also had the pleasure of presenting with Paul. I'll tell you guys, the one really exciting thing for me about Paul is that he is a dental consultant, but we've kind of stolen him away from the corporate world. And I don't want to say anything bad about corporate, but the one thing that dental schools don't train a lot of doctors is how to run a business. The business training is a lot of people in there selling disability insurance and talking about organized dentistry, but there's not a lot of practice management training in dental schools. And I really think that that's the missing link for some, is teaching them how to put systems in place and run it like a business. And the best experience I have from my buying doctors is doctors that worked for corporate dentistry before coming to me to buy a practice. So, that being said, when I met Paul, I was super excited. He has kind of the inside scoop on corporate dentistry. He worked as a regional manager for a major corporate dental chain for quite some time. From a system standpoint and replicatable experiences, he's definitely the one who can help you to make sure that you have a consistent experience by all your patients, and that the staff can put systems in place so everything they do is replicatable and repeatable, and again, to keep that consistent experience. So with that being said, we've got close to 250 people in the room. We're going to go ahead and get started with Paul. Paul is here. He's got a great presentation for us about reopening your office. We have had a couple practice consultants on here. I want to get a lot of different perspectives for you guys so you can get some different opinions on how we're going to do things. Paul's perspective and experience, I really like. With that being said, what I'm going to do now is I'm going to sit back and I'm going to mute my microphone and enjoy this presentation. A little bit of housekeeping though, if you do have questions as we go along, there is a Q&A box on your screen. Please open that Q&A box, put your questions and your comments into that Q&A box. Paul is nice enough at the end of the presentation, he's going to address as many of those questions as possible. Usually we get a ton of questions, and once we get going on the Q&A, people put more and more in there. You do have the chat feature on your screen. Use the chat feature to communicate with me if the audio is bad, the video is bad, there's some sort of issue going on. I think with that, we've got a large group in the room already. Paul, my friend, I'm so happy that you're able to join us, and I want you to go ahead and take it away, and I'm going to sit back and enjoy this. Paul, take it away, my friend.
Awesome. Well, thank you so much, Jonathan, and thanks again for inviting me this afternoon to go over some of the, some of this information that's out there that's very fluid right now. We all acknowledge that it is a very fluid situation. It is very unprecedented. And again, a lot of the material we're going to cover today, a lot of it I'm hoping is designed to help create more questions than anything else. In other words, help the dentists out here, the audience, to really help formulate some new questions for themselves as they prepare to reopen. Okay, so that's really the focus around today's presentation. And I do want to take and thank everybody, the participants this afternoon for participating. And we'll go ahead and get started. So, the title of today's presentation is Creativity and Execution. Really, that's the key, right? Because we really need to focus in on being creative at this time and really executing at a very high level. Okay, so that being said, let's dig into it. So this afternoon we're going to be looking at patients. We're going to be looking at your staff. We're going to be taking a quick look at your business operations, and then we're going to look at some enhanced and new front office and perhaps some enhanced and new back office protocols. And at the end, we're going to go over some Q&A with everybody. Okay? So to get started with the patients, at this point, communications is going to be key, right? So we want to focus on very high quality and very consistent communication. The communication should be what it is that's occurring now on a regular basis and what the office is able to do and not do at this point. Really important, okay? What we ought to be communicating is what the office can do, which is at this point, at least here in California, we're looking at dental emergencies and for our patients to be avoiding the emergency rooms. And we want to emphasize that it is for the dental emergencies. Some of the different platforms we really need to look at, to communicate through are going to be your office website. I feel that when I look at many dentists' websites, a lot of them, have an opportunity to be refurbished. And that's one area now where you can really leverage this and communicate the fact that, now that we're currently closed and we're only really seeing dental emergencies, that's something that ought to be communicated through your office websites. Through social media platforms like Instagram and Facebook. And on Facebook, maybe even consider video posts of yourself. I've seen a lot of these from dentists and from my own clients that have gone onto Facebook to explain what it is that the office is able to do at this point and not. Through YouTube postings and even through Yelp and your Google My Business page. Don't forget, guys, Google My Business nowadays is huge. It's got a huge impact on how your patients decide on your practice and also your reputation online. So make sure to go into your Google My Business page and update the postings on there. And that way patients understand what it is that your office can and can't do. The other thing that's really, really imperative, and I do want this to be a big takeaway from everybody, is that you communicate the enhanced PPE standards that you currently have or are going to have before reopening beyond the emergency patients, which implies we want to reassure our existing and new patients of your enhanced safety protocols. This is going to be really important. Do not overlook this. Whether it be through a new patient questionnaire that you've set up at the office, which we'll get into later on, or perhaps the new non-touch thermometers that you're going to be implementing to check temperatures of patients potentially coming in, or perhaps how we process patients, perhaps having patients waiting in their cars instead of waiting in our waiting rooms. These enhanced PPE standards, all of these new standards, we need to do a good job of communicating through all these different platforms that we mentioned before. Okay, and then lastly, and I do truly encourage our audience today to consider this, is creating some sort of a welcome back letter prepared for the patients once the office reopens. And this welcome back letter could entail something that references the new CDC guidelines, or the most up-to-date CDC guidelines anyways, on OSHA standards and those kind of things. So that way patients understand what it is that you're currently doing as a team to ensure their safety, okay? All right, so before we move on from this slide, I'm gonna go ahead and take a quick look at some of the questions that are on here. Okay, so we have a question about buying UV lights to kill viruses in each operatory. So I'm gonna go ahead and answer that very quickly. That's something, again, that's contingent on each office. It's up to each owner dentist. But what studies have found in my research is that as long as you keep the UV light on for a period of 30 minutes in a space, in a space of at least 8 feet, it has been shown that it will eliminate all the viruses in that area. So is that a good idea? Later on, as I get into the back office pieces, yes, I think that is a good idea. That's something that if you can financially, if that's something that is in the cards right now for you, that's something for you to definitely research and see if that's reasonable for you, okay? I hope that answered that question. And let's see, there might be another question here. Okay, so we'll go on. All right, the other factor right now with communication with patients is that's come up is teledentistry. And with teledentistry, what we're finding is something to consider. And this is a great option for patients that need to reach you, but are unable to reach you right now because of pre-existing medical conditions. And what we found, at least in my own consulting, is I found that pre-recorded text videos being sent over, in other words, a quick text video of a patient describing their condition, and then texting this over to the doctor, and then the doctor pre-recording a message back to the patient about their condition and what the next steps ought to be. I found that that's the most popular way of leveraging that technology right now. So in other words, It's not in the live sense, but in the pre-recorded sense. So that's something for everybody to consider. When you do this, there are a few codes you have to understand right now, and I do want to be very clear about these codes. There's 99.95 and 99.96. 99.95 is the live recordings, and 99.96 are the pre-recorded video messages. And again, you can charge these out, but only if they're coming in the same day for emergency treatment. Okay, so that's something that everybody needs to understand. The ADA actually outlines this, that if you do charge one of these codes out, it's based on the assumption that you're doing a digital consultation with them and a screening, but then that screening entails an emergency treatment the same day. Okay. Now, if you're doing a regular consultation, like a limited exam, for example, and it's through a teledentistry event with no emergency treatment, then that event should still be treated like it has traditionally been treated, which is that limited exam or that that follow-up post-op exam. Okay, so something for everybody to consider and understand. Okay, these details I'll provide to everybody after the presentation. You'll get a copy of my presentation if you email me at the end. I'll be happy to provide this to you. And again, you can use this as a resource down the road, okay? The next piece to say that I do want to remind everybody about is make sure to stay on top of what the CDC, the ADA, and the CDA releases, so that way you understand how to better inform your patients and be prepared for reopening, at least from this perspective, from the communication perspective, okay? All right, so before I move on from here, are there any questions? Let's take a look. Oh, I had another question.
And Paul, it's going to be easier to do all the questions at the end because it's going to be distracting to go back and forth. So people are receptive. You just want to go through the presentation, then we can do the questions. They actually queue up in the same order that you're presenting the material, so it's going to be way easier to do it that way. If you could, please.
Sounds good. All right, so we'll go on here. So this is some information and guidance around teledentistry for everybody, okay? The next piece I want to go over, and I'll briefly go over this, is going to be business operations. So operations at the office. Specifically, we really ought to be doing our due diligence right now and looking at deferring payments and assistance. And I'm sure many of the the folks here in our audience have already done that. But just to kind of briefly overview all the different points again, the payroll, and the overhead. You want to look at things like unemployment EDD. You want to look at the PPP from the SBA, right? We want to look at if you have or recently purchased the practice. You want to look at reaching out to your banks and seeing what kind of deferred payments you can set up with them. For your rent, you want to look at sitting down with your landlord and seeing what kind of deferred situation you can put yourself into. What I found is with these rental situations, when it comes to smaller landlords, they've been more open to discussing deferring payments. When it's come down to those larger corporations that own those larger retail spaces, we found that there's a little more process involved. So just everybody should be aware of these things. Okay. All right. So the next piece we'll go ahead and get into is the staff. First things first, and I'm sure everybody knows about this, but we should be aware of the Families First Corona Response Act, which was enacted by Congress. This provides for the free coronavirus testing. It provides for emergency sick paid leave, for those affected and to care for family members that are affected. It allows for a 14-day paid leave, okay, that for any workers that are affected by the pandemic. And also it allowed for increased funding for food stamps for this period, okay? The other thing that you really ought to look at right now before reopening is let's look at enhanced PPE protocols for the staff. We ought to really look at and consider rehearsing and staging these enhanced PPE protocols with the staff to ensure a successful implementation. So, this goes back to my corporate training, right? Going back to what Jonathan said. We were big and really big on rehearsing and training things before we implemented anything, right? So if you look at larger corporations, whether it be Boeing or GE, or, you look at, fast food, any of those, Chick-fil-A is a great example, or Target, right? Before they implement a new system, they're always going to rehearse it with their team. And as a team, I would recommend for you, when you go back, before you get started with patients on a more normal basis, begin staging and rehearsing and thinking about all the things that we need to start implementing. And I will be getting into more details about, you know, the tactics, if you will, down the road. But I do want everybody to take this away to start thinking about how you can find the time now to rehearse and stage the phased rollout as we come back into a more normal process. And also consider training the enhanced protocols remotely, right? You know, Zoom, GoToMeeting, any of these platforms, Google Hangouts, it's going to allow you to, let's say, you know, if you are still having your employees employed, you know, for you to go ahead and maybe set up a staff meeting around, hey, how do we start rehearsing some of these enhanced protocols with either your front or your back office remotely? Okay. And then finally, this is something that's going to be big for your staff, not only for your patients, but also your staff. When you reopen, you may want to consider recording the staff temperatures and documenting them for liability purposes, just to be sure, and I'll get into this a little bit at the end, just to be sure that all of our bases are covered. Okay, and I'm sure that's something that many of you maybe have not thought about, are the contingencies, right? What's going to happen if we do have a COVID-19 exposure event? You know, if we do have something like that, we want to record the staff temperatures and document these things for liability purposes. Okay, so I'll go ahead and move on from here. The second story about the staff, the second piece around staff that I want us to touch up on is communication with them is also very critical right now, right? Consider having and hosting regular webinars right now, conference calls, to stay informed and be prepared for the next steps, right? This morning, I was on a conference call with my team from West Los Angeles with a group of about 9 people and their staff, and we strategized what it is we need to start doing now. We need to start reviewing CDC, and in our case, the CDA guidelines on reopening, and what are some of the things that we're currently doing that we're not doing that we ought to be considering, right? So those are some of the things that you ought to be thinking about with your team, especially if you're in the Midwest right now, where, for example, out there, we're gonna be looking at an earlier opening period. This is a time right now where it allows you to prepare for these kind of things. At this time, maybe on these webinars, reconsider your current OSHA and HIPAA guidelines. Are we compliant? Are we doing some of the things that we ought to be doing? Consider creating teams before we reopen for emergency cases and versus a return to a more normal schedule. So what I mean by that is think about the team members that you currently have and which team members do we need now to see emergency cases versus the teams that we're going to need down the road for a more normal schedule. And also, here's the last piece, the contingency for non-returning staff. So what happens if a staff member, God forbid, let's say you furloughed them or we had to dismiss them during this period and they found another job or they're moving out of state? What happens if they don't return? Well, now we have to start looking at staff placement agencies, right? So, those are resources that we have here in Southern California. They'll place a staff member for you, whether it be a hygienist or front office or dental assistant. We have those placement agencies out here, and that's, something you need to start thinking about. Begin to think about preparing open position advertisement, maybe having an ad up on something like Craigslist or LinkedIn or Indeed, any of those resources for you. We need to start thinking about, do we have a relationship with the dental assisting schools in this area, right? So here in Southern California, we have many dental assisting schools that, I'm surprised many of my owner dentists don't think about, whether it be Concordia or American Career College, some of our community colleges here in the community. They have great dental assisting schools that if you plug into, you're able to pick up a dental assistant fresh out of school and train them the way you want to, right? The next thing is maybe even consider a staff referral incentive, right? So this is something that I regularly do where existing staff in our team, they may know somebody looking for a new position and, perhaps consider an incentive for them to refer somebody to the office. The next and last thing that I think that gets overlooked many times is social media staffing sources. So do we have a presence? Does the office have a presence on Facebook groups, right? So like, for example, Dental Peeps, Southern California Dental Peeps, Orange County Dental Peeps, San Diego Dental Peeps. We even have a dental assisting group that you can tap into. put up an advertisement saying that, you're looking for a new dental assistant. And that's a great resource for you to tap into organically, right? And again, and don't overlook LinkedIn. I've recently found 2 new front staff office members through LinkedIn simply because I had them, on my connections. And I just reached out to them saying, hey, look, I've got a new position out in West LA. Would you be interested in learning more? And next thing you know, they gave me their cell phone numbers. I called them and it was great. We created a relationship. We set up an interview. And it didn't cost us a cent because LinkedIn, as long as you have the connections, it's one way for you to reach out and find these professionals. Okay. So again, contingencies, guys, we have to start thinking about the best case and the worst case scenario and be prepared for those next steps. And again, we'll be taking questions at the end. So keep all these things in mind right now. The next thing I do want to touch up upon is with the staff, don't overlook the morale right now, right? Because morale does play a huge difference. We do want to continue celebrating the birthdays, the kids graduating from high school. We want to do these things as a team, even if it's through a webinar, just so that we can stay connected. These things still matter, right? Because I know you guys are all families, right? I mean, we see these guys in the office more often than we do our own families. So don't forget to overlook these things right now, right? These things still matter. All right, guys. And I encourage you guys to celebrate these things. Next thing, set goals for your staff right now. If they're still employed by you, if you took advantage of the payroll protection program or the EIDL program, if they're still on your payroll, set goals for the staff right now, right? So I have an office out here in the San Gabriel Valley. My owner dentist is still employing, the 2 employees he has. And instead of seeing patients on a regular basis, twice a week, they're cleaning up their front office because they want to go digital, right? So this is a great time to do that because they're not seeing a ton of patients. So twice a week, they're setting a goal for themselves and getting rid of all their charts and they're digitizing. So again, set goals and set goals for yourselves. Okay, this is not a time to hang out. This is a time for you to get onto webinars, learn, and empower yourselves. So that way, when you get back into the operatory, you'll be better, you'll be more knowledgeable, you'll be better prepared to get back at it. The next advice I have, especially for my own teams when we have our webinars, is record the virtual meetings. Record the meetings and set measurable goals for yourselves. You'll be surprised that through Zoom and GoToMeeting or Google Hangouts, you can record these meetings so that way, having a record of what it is we talked about, the ideas that, Maria provided or that Jennifer provided or that Anthony talked about or that new thing that we wanted to implement or, that detail that we wanted to get to. When you record these virtual meetings, you're able to go back and see what it is that you had wanted to do. This is a great way of measuring whether or not we're doing what we say we want to do, right? So that's huge. Set attainable challenges, right? Make this fun, make it engaging. Consider putting teams together around these goals and see who gets there first, right? Make it engaging for these guys. Make it so that they're still incentivized to want to continue growing the office, even if it's remotely or at the office. Let's say we want to go chartless, and making this a fun thing. Who goes faster in getting the charts in? Who's more accurate, right? Who's making less mistakes? These kind of details, so that you get to the goals that you want to hit. The other thing during this time that you really ought to reconsider is, and I know we've all observed this in the last year or two, Google, LinkedIn, Instagram, Facebook groups, all of these platforms on social media are huge, and they're going to become more important now, more than ever, with people communicating with each other through their smartphones, right, guys? People live through their phones, and the reality is during this time with your staff, we really ought to consider relaunching your social media strategy and how it is and what it is you're doing to communicate to your patients. Your patients care. They want to know what's going on. And so if you're doing a great job, like for example, I have many orthodontists and pediatric dentists, they're big about advertising and, communicating through social media, and they do a great job doing it, right? Because it's fun. They have teenagers that follow them, and they see their stupid little challenges on who makes the most Reese's peanut butter cups, and these kind of fun things. So reconsider what it is you're doing on social media, and this is a great time to re-implement that, right, to make it fresh. So these are all the different, what I call soft power, if you will, elements of the office that you really ought to be reconsidering right now remotely, that you shouldn't overlook. So that way, when we do get back into, let's say, the new normal, you'll be, in a more advantageous position. Okay. Now the next part of my presentation is more around tactical questions. So these are the specific things that we really ought to be looking at, and what it is that we should be considering in terms of providing more of the protection that people, especially whether it be the patient or the staff, are now going to expect. So with the front office, we should be looking at front office enhanced PPE protocols. And what are some of these things? So for example, have contingencies been met, right? What thresholds have been met so that we can start reopening in stages? So what I mean by thresholds are, for example, here in Southern California, has the city and county of Los Angeles, allowed for dental offices to reopen? Has that precedence been set? Well, if that precedence has been set, that's one box you check off in your checklist, right? The next level could be in our case in California, has the CDA and the ADA recommendations come out, and have they said, okay, it's okay for us to go into our first, stages of reopening? Okay, if that box has been checked, let's create a checklist around that. So these contingencies or checklists is what I'm suggesting, is let's look at the different resources out there, the checklists out there that are going to allow for these reopenings. Here in California, we're fortunate to have the CDA, and the CDA actually has a great resource, which I'll get into at the end, that does, outline these recommendations, okay? The next thing is, do we have a phone guide, a patient triage phone guide set up? Okay, again, here in Southern California, we have the CDA. They put out a nice guideline of how to triage patients before they even come to the office. So for example, asking patients about where they've traveled recently, have they been exposed to COVID-19, their current medical state of health. These kind of questions to see, okay, are you a candidate for coming in now, or are you a candidate for not coming in because of, pre-existing conditions, and those kind of things. The other thing that I would strongly recommend, I would encourage our audience to look into, is perhaps looking at a lead assistant as the main patient concierge, if you will, let's call it that, give it that title, that will begin working with patients from beginning to end in order to minimize exposure, okay? Now, this is something that's not too difficult. If you have hygienists, for example, you have a strong dental assistant, your hygienists might be the ones in the future to work with your, regular cleaning patients, and then your dental assistants perhaps for your restorative patients. But the point is, let's not get too many people involved in being exposed to patients as you come back to the office. And that's why I put out this type of recommendation, okay? Something for everybody to think about. Again, creating more questions for you to think about. The other thing is we want to reconsider the waiting room at this point, right? Essentially, the big recommendation now is to perhaps have our patients wait in the car, right? And for them to be contacted by our front office to let them know when it's appropriate to come in and out. Okay, that way we limit the number of patients in the office. And the bottom line here is removing the clutter that's already in the waiting room, right? This is something that we don't want to have, which just creates more liabilities for everybody all around. The next thing is maybe perhaps even consider a staggered patient schedule based on risk factors, right? So you look at risk factors like health risk factors and age, right? So this is a tie-in to the grocery store senior hours. Something for everybody to think about. Again, more questions to think about is, how is it that we're going to be able to see some of these patients based on their different risk factors down the road? And also for us to consider enhanced infection control procedures for both the staff and the patients, right? And I'm going to go into this here in a second too. So here's an example And I do want to provide very tangible examples of what it is that I'm currently doing with my dental offices. I know many of you are probably taking out your smartphones right now, taking pictures of this. This is a specific example of an office that I work with in the San Gabriel Valley here in Southern California. And so when a patient walks in now, they're given instructions on what to do next. So we have PPE here, we have a hand sanitizer, we have consent forms out here, and these are new COVID-19 consent forms and disclosure forms, okay? Once they have this material, then they sit down. Instead of going into the waiting room, they sit down here out in the hallway and they fill out their information. And then once they come in, they put their information in this box. So they're given instructions on what to do in each step. And then they stop here in our front office, which has now been plexiglassed off with this temporary plexiglass, where our front office can go ahead and take their temperature through here. Okay, so again, I want to provide very tangible items for you guys to look at and give you an idea for what it is we ought to be looking at to enhance our front office PPE protocols. Okay, so what are some of these things? We need to develop an enhanced entry system, right? Something for us to strategize around in our webinars with our teams. We need to implement enhanced front office PPE protocols. You know, perhaps look at non-touch thermometers, which is going to be huge. Look at new COVID-19 consent forms and disclosure forms, and look at maybe a temporary or permanent plexiglass shield for our front office. And perhaps, again, redevelop that patient entry system. Okay, so in this case, I have all of these materials. I'm happy to speak to any of you and provide some of these checklists to you at the end. Just go ahead and email me and I'll be happy to provide some of this information to you then, okay? The other pieces to consider are, when it comes to the front office, with patient scheduling, we want to be looking at perhaps reconsidering a staged reopening to acclimate both the front and back office teams so they become accustomed to some of these enhanced protocols. Again, going back to that recommendation about how successful corporations like Target and Chick-fil-A, how they implement some of their new systems, you always see them together as a team in the store rehearsing it. Right? They rehearse and they practice what it is they need to do. And I strongly recommend that you look at doing some of these things in a rehearsed setting before you roll it out. That way we can work out the kinks. Consider your operatory layout in the office, right? Let's consider what you can and cannot do in order to minimize exposure and enhance safety. You want to set goals with the team now, right? Because again, when you're in that process of rehearsing, we're in that situation where we're together a little bit more. We want to look at, how do we set these goals and how do we incentivize the team so that they will be successful, right, in implementing these new procedures, right? So those are all my thoughts around the front office right now. I'm hoping that some of the things I've shown you in these slides will help to create more questions. That's the goal of providing this information, is that, as owner dentists, as small business owners, the whole point in doing this is so that we can start to question, okay, what it is I can do, I cannot do, what it is I can maybe take and modify, right? And do these kind of things. So, again, I'm hoping that was, from the front office perspective, will help to begin to help you create those questions. Here's some of the back office enhanced protocols that we want to look at now. Again, contingencies. What thresholds have been met in order for us to go ahead and do some of the things that we want to do from a back office perspective? And again, go back to your state mandated associations, like out here in Southern California, we have the CDA. They've got a good checklist on what it is we ought to be prepared for before we start opening up in stages. At this time, because we're not seeing as many patients, or maybe perhaps no patients at all, perhaps consider deep office cleaning. And again, going back to that concierge who is perhaps seeing one patient at a time, or it could be another assistant, but somebody who is now considered the infection control lead, or let's call it an infection control officer. And that officer becomes the auditor, the person that oversees staff compliance, becomes the communicator between the staff and the doctor on infection control at this point. and the documenter, somebody who is responsible for documenting both staff and patient temperatures, the new consent forms, their updated medical histories. You know, the documenter, the person you go to as the dentist and say, Tiffany, where are we at today? Let me see our COVID-19 compliance book or our infection control book. And, you know, do we have every patient's temperature today when they came in? Do we have everybody's consent form that they understand what their liabilities are, what our liabilities are? You know, have everybody signed off on those things? You know, who's that person that you go to now that on, let's say you have your staff meetings twice a month, that is overseeing all of these details so that they don't get overlooked. And so this is a position that we don't need to reinvent in any way. I would encourage you to find somebody that is more responsible, more proactive in the office. And, you know, again, this is going to be a big role. And, you know, as we go into our phased openings, and for them to be able to really get a handle on what's going on. Because as you know, you're in the patient's mouth. You're not going to have all this time to oversee this, but if you have an individual designated to do this, at least you know that the tactics or in the weeds details are being taken care of, right? Next thing is, you know, perhaps reconsider your intake checklist. You know, what it is that we're doing to bring patients back. You know, do we need to reconsider some of the details? Like, for example, when you go over the medical history and or the recent history in your consultation exam, is it going to be the same questions that we had before? Probably not, right? Because we're going to be asking things like, have you been in large groups recently? Do you have any family members that have been exposed to COVID-19? You know, all of these, you know, have you been overseas? You know, any of these type of questions and specific health related questions, we need to start creating checklists around. And again, here in California, we have the CDA that they've created a nice checklist of how you can start to interview patients prior to them coming in. But even when they're in the chair, you know, how do you engage them, right? And also, and this is a back office protocol we should be thinking about, are vendors, right? We have many vendors that come into the office, whether it be the lab guy, you know, UPS, the post office guy, you know, they're bringing in something to the office and these materials need to be sterilized, right? So something for everybody to think about is how do we handle this material now? And, you know, let's add on top of that, you know, we're seeing normal patients, we have patients going in and out, we have boxes and letters going in and out. How do we sterilize these things, right? And finally, you know, consider creating an exposure checklist, right, from a back office perspective. And this ties back in with your infectious control lead or the infectious control officer. What happens when we have an exposure event, right? If we do have an exposure event, what's the recourse, right? It's something for everybody to think about. And I'll get into a little more detail in a second. All right, and you know, going back to that question about UV lighting, that one of the doctors had. This slide goes into many of the things that I know as clinicians you're more interested in. What it is that we can do to avoid, you know, cross-contamination and those kind of things. You know, and I know you've probably heard this from other consultants. Rubber dams when we're doing restorative work. Peroxide rinses for our patients before, you know, we start working with them. You know, currently wearing surgical gowns, hair nets for anybody that has longer hair. Perhaps at this point, instead of using the piezo or the Cavitron, you know, we maybe ought to be consider hand scaling at this point, right, to minimize aerosols. The other thing is looking at perhaps having office shoes. So instead of going in and out of the office with your shoes from outside, perhaps having one set of shoes in the office that doesn't get contaminated by what's out in you know, the outside world. The other thing that's become very, very popular recently are these devices called aerosol terminators. So I know everybody can see this image here. You know, when you have your handpiece going, you know, the aerosols are flying everywhere. These aerosol terminators essentially suck up all the aerosols and prevent or at least try to minimize the aerosols from getting into in the environment. Okay, and I'll get into this in a second. You know, we look at things like minimally invasive dentistry right now with silver-diamine fluoride, right? We arrest cavities from getting any worse. We look at devices like Isolite, which will again help to evacuate aerosols. There are devices like this Dentsply Jet Shield. This Jet Shield device was very, it wasn't very well known until recently, where this device sits on the tip of your cavitron and it helps to minimize aerosols from flying up in the air. I know this is very popular, full face shields and full face shields with loops on. Protective eyewear for both the patients and the staff. And finally, ultraviolet light sterilization. And going back to that doctor's question earlier, yes, this is effective. However, it's only if you leave it in a space for a period of 30 minutes, minimum 30 minutes, within 8 feet of the space you want to sterilize, okay? So it's got to be within 8 feet. And if you're looking at cupboards and those kind of things, you're going to have to make sure that your UV light is able to penetrate through the cupboards and there's no shadows. So again, within 8 feet, it'll do a great job. It'll sterilize. But this is something that you'll have to look into to see if it'll work for your office, okay, for the specific layout. So these are all of the tactical things that we could do, right? These are relatively easy to implement. It's not asking too much that we implement some of these things. I'm sure most of you are implementing some of these things already. But these are all the things that, I want everybody to start thinking about. The last thing I'll throw out there is I've got a couple offices that I currently work with that does ozone therapy. And I don't know if, many of you are familiar with that therapy, but ozone therapy eliminates viruses and bacteria in the environment, right? So that's also something for you to think about. And again, I want to raise more questions here. That's the purpose of having this presentation, is I want you guys thinking about everything outside the box, right? What else are we not doing that we should be considering, right? Hopefully that was helpful. The other enhanced protocols to look at and that we should think about is exposure event. Okay, and I know this is something that's new for everybody. So what happens when the submarine goes down? Do we have a blue book on how to respond, right? Because when the sub is hit, you got to know where to respond, what to control, how to contain, right? So in an exposure event, some of the things I want everybody to start thinking about is, are we recording and documenting patient temperatures? Are we recording and documenting consent forms right now? Are we keeping good documentation on their medical history? All of this is designed for the purposes of liability or limiting liability for all of you, right? Big deal, especially an exposure event. What are some of the legal ramifications, right? I know that Jonathan's going to have a great attorney up next week. I think his name is Drew Henricks. I'm sorry, not Drew Henricks. I'm sorry, Jonathan. Can you go into who the attorneys are going to be that's going to come up next week?
Yeah, so for the attorneys, obviously I know a lot of dental attorneys, and the dental attorneys are good at transitional work, and they're really good at a lot of different things. But most of them have referred me to employment-specific attorneys, and there's two of them I'm talking to right now. I'd like to have them both on. I'd love to give you guys different perspectives from different people, but two employment-specific attorneys, because we have a lot of questions about, if the staff becomes infected, asking the staff to work during the closure time. So Drew Henricks is on Thursday. He is the Q&A with the CPA. That's going to be a great meeting because we just got a new funding of SBA and PPP money. So, but yeah, we are going to have some attorneys on, and some of the attorneys that the dental specific attorneys, I just got a name here in the chat. She even herself is referring to one of these employment specific attorneys that's laser focused on employment issues.
Awesome. Thanks, Jonathan. So if anybody wants, to dive into that a little more detail as far as what are the legal ramifications in your liabilities, please stick around for that presentation. The other thing is, who are the people we need to notify, right? Because we have staff, we have vendors that came in, we have patients that have been exposed. Again, I want this to create more questions for in your mind is, what kind of COVID-19 exposure event checklist do I need to create so that if this were to come up, right, what's the recourse? And so something else for us to think about, remediation services, right? Now we have to look into having a decontamination company come in here and remediate the environment, right? Decontaminate the environment. In doing this, I strongly recommend that anybody that is ever in that situation, make sure to ask for references from the service to ensure their quality, because I'm sure none of us have had to decontaminate, your office before. So if you're in that if you're in that situation, make sure to ask for references to ensure their quality. And then finally, I've included a link here, and again, you'll get this presentation at the end of, essentially what the exposure protocols would be for our environment. The CDC has put out a nice guideline around this. So again, please, delve into more information, look into it for yourselves, create the checklists, so that way you'll be prepared. Some of the last pieces here, I've got some other guidelines and resources for everybody to look into on your own time. This is in one place. But some of the things are, for example, some of the OSHA guidelines that have been put out on workplace guidelines, the CDC guidelines on dental, as we stand right now, the CDC guideline on exposure, and the CDA here in California has a nice guideline on how we should either reopen or see patients, and also patient questionnaires. There's even an ADA guideline here on billing for the front office, which is very useful. And then some other guidelines on reopening from Patterson. So this is a very specific equipment reopening checklist. And this last link here is for a company that manufactures that aerosol terminator that we talked about earlier. Okay. All right, great. And this is we wrapped up a little earlier, but I've got a great Q&A session. So if any questions, feel free to go ahead and ask. Before we get into the questions, I do want to make a statement that these materials are available to you. If you want to go ahead and email me at the end, I'll be happy to provide some of this material to you. Yeah, go ahead and shoot away.
So, Paul, thank you so much. That was fantastic. We had a ton of questions on here, and I really liked that Patterson link about starting the office back up. And I'm trying to get a Patterson rep to come on, and I think I've got some lined up. I don't want to put them on blast, but if you're in Southern California, Mark Miner is one of the best minds in equipment, and I'm going to ask him to join us next week just to have a discussion about bringing the office back online and all the different protocols. And perhaps Mr. Tom Slezak can join us as well. I see him in the chat room, so I'm going to shout out to him and see if he can join us. But a great presentation, Paul. And again, I love your perspective because it's more of a corporate perspective. And sometimes with these offices, you need what's called executive buy-in. And this is when you say, here's the idea, and we're going to put a system and rehearse it and put it in place. We're not just going to have an idea that's sitting there on the table. We're actually going to rehearse this and make this part of our protocol in the offices. And nothing against what any independent dentist is doing right now, but this mindset that you bring of bringing kind of that corporate mentality that, this is the way we're going to do it. We're going to rehearse it, and we're going to make it part of our fiber. So it's a natural part of what we do. With that being said, Paul, I appreciate there's a lot of questions here. So let's go ahead and dive into those and go through some. I'm going to throw them at you. And Paul, I'm going to preface this by saying, if you don't know the answer, since a lot of this stuff is evolving and developing as we speak, feel free to say, Jonathan, that's a great question. I'll do some research on that. Maybe I'll come back in a couple of weeks and be able to share what I know about that information with you guys. So the first question, Paul, is from Penelope. She says, how about air purifiers such as virus plasma technology in each op and throughout the office? Thoughts on the different purifiers?
I've been talking to my West LA doctor about air purifiers too. And honestly, I'm just literally looking at the surface of this right now. I don't have any thoughts on them right now. They sound good on the surface. Everything, the science sounds good on the surface. The advertising sounds good. I don't know enough to speak about them, honestly. What I've read about sterilizers, I would say I know more about. So that is one question I would have to take forward with that.
Awesome. Thanks, Paul. The audio is kind of going in and out, so I'm going to mute between questions just to make sure it's not me.
Sure.
Dr. V is asking, for the code D0140, need to send with teledentistry codes, the D9995 and 9996. So do you need to send that code with those codes, Paul?
Right. So in the case of United Concordia, for example, they have put out a statement that you are required to put those two codes together, depending on whether or not you're doing it live or recorded. They also want you to put it out with the limited exam. So it depends on the insurance company is my answer to that question. But on its own, the ADA has said that if you're doing it on your own, they are independent of each other with the exception of United Concordia.
Perfect. Mary's asking, is the family leave applied to employers who have less than 5 employees?
So from what I understand about the family leave, and maybe they need to be a little more specific about that question, but the new one that came out is supposed to be if you were below 500 employees. So I think this family, if she's referencing FMLA, I think that's something else, right, Jonathan?
Yeah, and I'm going to go ahead and table that question and have one of the employment attorneys take a shot at that. I can't give you an answer, just like Paul. Not that it's not a great question, but I don't know for sure, and we'll have one of the employment attorneys cover that. Paul, Gretchen's asking, if we conduct regular team webinar meetings to prepare for our return, are we expected to compensate the employees for that time?
Yes, you are. And that's why I prefaced the statements earlier about if you still have your employees employed and you do want to engage them at this point remotely, that's definitely an option for you. But yes, so in answer to that question, you are required to compensate them for that hour of, let's say, webinar staff meeting time.
And Paul, one of the things, it's just like you and I, I could ask you to go to lunch or do something fun with me or join me for a fun webinar. Is that different than asking them to do something under the scope of employment? And it's entirely optional. So we can still have team bonding and team engagement, even if they're not currently on payroll or being employed. Do you find that to be true?
Yes. So that would be the exception.
Okay. And then please detail how teledentistry codes work. See patient same day, etc. What are people charging for this? And what are offices charging insurance and patients for all the extra PPEs and other corona-related costs that we have to put in place?
So the answer to that first question, the best answer I have is I recently looked at a cross-referenced study that came out that looked at downtown Los Angeles. It was of a very specific zip code. And what came out was in those teledentistry events, what was being charged was very similar to your average, let's say, limited exam or your or like a post-op visit. Essentially, it's very similar to those fees in terms of what was being charged. And then, Jonathan, I didn't see the second half of that question. It kind of went away.
Sorry, I just missed it. Let me go grab it real quick for you. What are people charging for these services, and then what are offices charging insurance and patients for all the extra PPE? So I apologize. The question would be, what are we charging for teledentistry if we're doing fee for service, and then the insurance codes, and then what are we charging for all the extra PPEs and corona-related costs that we're incorporating into the practice?
Right. So I think I answered the first part of that question, which is that's very similar to existing visits. What are offices charging insurances and patients for all the extra PPEs and other corona-related costs? So then, that is a question that is a bigger question amongst itself, right? Because, we're just getting into this now. And yes, I agree that, you're investing into things like UV sterilizers. We're investing into additional things like aerosol purifiers. Right now, we don't have an answer around that, quite frankly. As I learn more with my clients, I'll be happy to share. But I don't have an answer around how much more are we charging patients on a, let's say, a cash basis.
Perfect. Paul, what about the effectiveness of industrial air filters? Are they worth having in each of the operatories?
Again, I think this is kind of like that.
Yeah, it's a similar question.
Yeah.
And the one thing on that, Paul, that I want to say is that when we talk about a lot of these things, my fear is that people are going to go out and spend an incredible amount of money. One of the things you did show was that I think it was the UV light robot, and I don't know the cost of either renting that or having that in the practice. So it's a little bit precarious that we could spend incredible amounts of money on things that might not be effective or needed. And I can't pass judgment on whether something's effective or needed, but I think that the more of these calls that we have, we're going to come to consensus of what's a good investment and what's not. Did you show the robot? Was that in the? And first of all, Paul, I got to stop and say your visuals were amazing. I love the fact that you had marked out an office with the reception area and receiving the patient and the chair outside of the waiting room. So that was awesome. But then that one photo you had with the UV light, was that the robot in there, or what was that unit?
Well, and again, to your point, Jonathan, we're not making a recommendation everybody run out and pick up all these materials, right? We're really looking at what's available out there. And that was the whole purpose of showing that UV robot. It was to illustrate to our audience what, some of the enhanced protocols that could be in the future. And again, the purpose of having this presentation is so that we can raise more questions, so that if it's appropriate for some of these dentists to go out and look at some of these things, absolutely. So that, that's basically what that was meant for.
Okay. And then Paul, the next question was, some people want to get access to that COVID consent form. And a second part of that is, some people have said that their insurance carrier, one of the big ones here in California, is TDIC, is saying to not use a secondary COVID consent form. And in fact, just use your same consent form you've been using before. So a two-part question. You will provide links and emails to provide them with that most recent COVID consent form. And then how do you feel about their insurance carrier saying, don't use that form, let's use it under our same blanket consent form we had before?
Well, let me clarify that a little bit. It's actually a disclosure form and a questionnaire. So just to be more, to be clear, it's more of a disclosure form so that the patients understand, what some of the liabilities are. And then the other thing is the second piece is the questionnaire. So it's not really a consent form, just to be clear.
Okay, perfect. And I think that there is a COVID, quote unquote, COVID consent form out there somewhere. So if that is your question, we will definitely locate that. But I would want to explore, why the liability carrier TDIC is not having, it's telling people not to use a special form for that. In full disclosure, I can tell you guys, I worked for TDIC and the CDA for about a decade. I was the TDIC rep in Southern California and the entire state of Nevada. I'm a huge advocate of TDIC. I do have my own insurance company, the Doctor's Insurance Broker, that does the same thing, but I'm a huge advocate of TDIC, all their products, and how it helps organized dentistry stay as organized dentistry. But that being said, there's potentially something there where they don't want to specifically address that one liability and call that one out when they do have a blanket consent form that says they're covering other things. Paul, what is the protocol, Dan is asking, if patients answer in the affirmative for one of the questions on the COVID screening, but has a normal temperature?
That's going to be a more clinical call, and I'm going to have to defer to that clinical decision-making. As a consultant, my advice around that would be that, again, perhaps to get in touch with their physician or that patient's PCP to see where they are and perhaps go from there. But yeah, again, that's more of a clinical scenario.
Definitely. And from a legal perspective, and asking the patients these questions and what they're willing to disclose, and then whether you're willing to keep treating them or allow them into the practice if one of these COVID items pops up, we're going to cover that on a subsequent call as well, get one of the dental attorneys on to talk about, how we can address this with the patients and not have any issues. Paul, Mike is asking, are disposable gowns recommended to be changed after each and every patient?
Yes. And then again, from a practical standpoint right now, I understand how impractical that can be, especially how difficult it is to locate some of the PPE that's available or not available. So in answer to that question, yes, they ought to be doing that.
Perfect. Paul, when we talked about deep office cleaning and sterilization overnight, we mentioned that there could be services that come in after hours or each night to clean the office. And in my mind, I could say, well, I can grab a bottle of Clorox bleach and a rag and charge thousands of dollars to clean offices every night, but possibly not be as competent as someone that's really doing that. So the question here is, who do we call for deep office cleaning? And then, well, how do we vet those services to make sure that we have someone that's really doing a solid job and not just advertising something and taking advantage of the situation?
Yeah, and that's two parts, right? I would say on the one hand, start with the people that you do know, right? The dental suppliers that you're working with. I'd recommend you start there to see if they know of any resources, perhaps reaching out to your colleagues that you're close with in the area. And then lastly, when you do locate one of these deep cleaning companies, to go ahead and check their references, right? Make sure that they're legitimate so that you know that what they're doing is legitimate and their results are what it is they advertise. But as far as recommending anybody, I would say start with your supply companies, the supply reps that you're working with, and see who they know, and then move on from there. Again, the remediation companies that are out there right now, the Aftermaths and those kind of companies, that's not a bad resource too, to look at that.
Yeah, that's perfect. And I do have a message here in the chat from one of the Patterson reps, Tom Slezak, who's been nice enough to assist me with information. His comment is he highly recommends that we all wait to hear from Mark Miner, one of the Patterson reps, before going out and spending a lot of money on non-returnable products and panic buying some of these things sight unseen. So, I agree with you, Tom, and I look forward to having Mark on here, and hopefully we can get him on next week early to help us out with some of the other products we should buy. And then back to Paul's reference, maybe Mark has a vendor that he might suggest for that overnight deep cleaning, because it's important, again, that we can spend so much money on, PPE products and PPE and sterilization and cleaning the office, and some of it might not be necessary. Paul, and I apologize if you've answered some of these. I'm kind of reading them in order. What are your thoughts on UV wands for sterilization of surfaces?
Again, as long as it's within the bandwidth that the medical community is recommending, and that it does sterilize and does the things it's supposed to do. But again, keep in mind that you're going to have that UV light, over that area for a period of 30 minutes, and within 8 feet of where you want it to where you want it to decontaminate. So that's something definitely for you to keep in mind. But again, the medical community, the science community does show that UV lights work, but only in that format.
Perfect. Paul, we are at the top of the hour. We scheduled this call for 1 hour. We still have a lot of great questions, and we still have well over 300 people on the call. At this point, I'm going to tell you guys that, you do qualify for the CE. You will get an email for that. If you have another call or another appointment, I appreciate your time and I respect your time. We're going to continue and answer some of these questions here. Paul, if you have the time to help us out, we definitely appreciate it. We'll go a little bit longer and answer some of this Q&A. So again, I appreciate everyone being here. It's at 2 o'clock, but we'll keep going through this Q&A. Paul, is that okay with you?
Sure, sounds good.
Awesome. Can we see the referenced infection control corona forms the patients sign in for the waiting rooms? So Paul, as far as all these forms, it's safe to have them email you at yuamp@elitedentalsvc.com?
Yes, I'm happy to provide some of these forms to them.
Perfect. So any of the forms, and then Paul, you did put up a great list of links, hyperlinks. Hyperlinks, unfortunately, don't translate on the webinar. You know that, but sorry. But if you can share those links as well. So if any of you guys want to see that information, get those links, get the forms, email Paul. His information is on the screen right now, his cell phone number, his email address. You can get a hold of him to get those things. Paul, Monique asks, do you recommend front desk to wear masks and leave shoes in the office?
Yes, if it's feasible. I think at this point where we are, if you still have the front office coming in to see emergency patients, if it's feasible, then yes, definitely.
And then this one might be one for the employment attorney. Maria's asking, I have a two-part question. Can you force staff to go back to working? And if not, is it fair that the reason is because they are receiving unemployment benefits anyways, so they don't need to work at this time and scared to get infected because they have kids that can get sick as well? Thank you. So, Paul, it's kind of an employment question, and I think we've covered it on previous calls, and I'll say that the answer from the attorneys was, once you reopen the office and you offer them that employment, you have a business to run. So if they are unable to come back, you unfortunately have to say that they didn't come back to that position. It might compromise their unemployment benefits, and then you need to fill that position with somebody else. And you cannot guarantee them that when they decide to come back, their job will still be there. We're going to cover that in detail with the employment attorney. There's a lot of really good questions there that we'll go through and see how we can address that. TDIC not recommending the COVID-19 consent form. We covered that. Your thoughts on Cava wipes versus BioSurf, which today is not available?
Okay, so I have to be honest, I don't know what BioSurf is, honestly. So I would defer that to maybe a vendor or like a Patterson rep to answer that question. Okay,
then we'll get that on when we have, hopefully we can get Mark on next week. And I've said his name so many times I feel bad. Hopefully he's not busy and he can join us. He's a great guy, and I will reiterate that, but I would love to have him on the call with us next week if we could. Your thoughts on air purifiers, we've covered that. Could you put up the last screen again with all the info on the websites listed? So maybe you can go back to that for a minute or two, Paul, and show them that if it's not too much trouble, and then we'll come back to your contact information. I want to make sure that it's important they can see that.
Sure. And again, I can provide the presentation to your email these, these links over to however your audience would like to get them.
Perfect. And then, Paul, what are your thoughts on using a fogger/mister in the treatment area afterwards?
A fogger?
That was the question verbatim, and I'm sorry I just missed it. But fogger/mist, or some sort of decontaminant or disinfectant in the treatment rooms. If you're not familiar with that, we can probably table that one with the equipment rep as well. I'm not familiar with that myself, but we can table that for the equipment rep.
Honestly, I'm not familiar with that type of treatment or that modality.
Okay. Paul, this is a good one. Seeing the costs for office operations are going to significantly increase potentially, the daily income may decrease due to reduced patient flow to accommodate appropriate distancing. Is there information on if insurance companies will accept increased appointment fees to help offset and cover these costs?
At this time, I haven't heard anything from the insurance companies, from the offices I'm currently working with, nor from my insurance contacts. So unfortunately, at this time, I haven't heard of anything where the insurance companies will be helping out, if you will, by increasing reimbursement. What we do know is that with Delta Dental, they recently deferred their premier fee reductions to January 1st. So if there's anything that has helped, that would be the only thing that I'm aware of. Oh, Jonathan, we lost your audio there.
Sorry, perfect. It's a great question, and I'm glad that it's a great question somebody asked. Not a definitive answer. Sorry, I'm toggling the mute on and off just to make sure there's no problems with the audio when you're talking. Paul, Tanya's asking, as far as dental hygiene, will there need to be more time per patient?
Yeah, that's a very, again, loaded question, right? Depends on the modality, depends on how many patients you're seeing, depends on how long the individual hygienist takes to do the work. But I would suggest a blanket answer would be, for the time being, yes. We can expect that, given that we are going to have new procedures at the office and the social distancing requirements that we're going to have to implement in the office. For the time being, in the beginning, again, going back to the whole phased and staged reopening and rehearsing the reopening, we want to take it, with baby steps to understand how it is that we're going to be able to see the number of patients and go on from there.
And what do you think about the use of the Cavitron? I'm not sure if you covered that, since this might be an aerosol based transfer of COVID-19, and the use of the Cavitron. Do you think that that's going to increase the time of the visits if we're not using the Cavitron?
Right. And the whole recommendation around perhaps hand scaling for the time being and those kind of things. Yes. So that all ties into each other.
Perfect. Someone's saying they cannot find the Dentsply Jet Shield on their site. Can you reference that, or where we might find that? If you don't know, I can table that for the equipment rep, but that was a product you'd specifically mentioned.
Yeah, if you can table that for the distribution guys, I'm sure they can find resources for our audience.
All right. Somebody asked if there's CE available for this course. The answer is yes. Paul, do regular disinfectants like Clorox wipes work on surfaces or counters in the treatment rooms? So is there a differentiation between what product you should use to disinfect the treatment rooms?
Were there specific products they were asking about?
They're asking for Clorox wipes, just regular disinfectants like Clorox wipes versus some specialized disinfectant that they can utilize in the treatment rooms.
Cavi wipe, right? Perhaps.
Correct. Exactly. Yeah.
Again, I'm not an equipment person or a materials guy. I'm gonna have to defer that to the vendors.
Okay, and someone asking Lysol disinfectant at the end of the day. So I appreciate that, and it's good that hopefully this call is going to prompt Mark Miner to come on. He will. I've been too busy to talk to him setting this up, and being a full-time practice broker, which I can't wait to get to this afternoon after these calls. Do you think we'll eventually get a tax credit for these expenses for COVID? Remember the ADA disabilities tax credits. So do you think there'll be any tax credits or subsidies to offset some of these extra expenses?
That's a good question. If I'm going to speculate, I would speculate that that's something the ADA would probably have to go to bat for us on, right? I mean, what's your take?
It's going to be interesting. The efficiency of the office and is going to decrease, and the overhead is going to increase. And how we offset that, and whether someone's willing to subsidize that is going to be interesting, because profitability in a dental practice, if you're doing well, it should be about 35% of collections. 30% of collections is doing pretty well in Southern California. or in a dental office. And, with the increased overhead with the PPEs and the decrease in efficiency of seeing a multitude of patients, we're definitely going to see a change. That who is going to offset or help out with that, whether it's the insurance companies or some sort of government subsidy, that's to be seen. I hope that something would come through, but there's no guarantees with the insurance carriers or the government, unfortunately. Paul, what do you think about a machine to suck up all the aerosol? It is so bulky and takes up lots of working space. That might be another equipment question for you.
Yeah, and again, I provided some of those resources for everybody just so we understand what our options are and to open up more questioning. I don't have any specific opinions of what works better than others, or functionally what takes up more space or less. I would say that that's more of a vendor question.
And I appreciate your honesty, and I apologize. I'm always reading these questions live because they're queuing up so quick. So I feel like I'm just giving you loaded questions that are definitely equipment based. This one's good though for you. If we provide consultations over the phone and or texting emails, can we bill to insurance, or does the insurance pay for this? What codes would you use?
Right, and that goes back to my slide earlier about the $99.95 versus $99.96. So whether or not we have a live event or a pre-recorded event, that's something that you can bill out. As long as you document it and you clinically chart for it. And as long as you're doing all of those things and then you provide the insurance, there shouldn't be any reason for them to deny it, as long as you're within frequency for the year.
All right, and just a couple more questions. Again, Paul, I can't appreciate enough of your time on behalf of all the people that are on this call. I definitely thank you. This one's asking, will you normally use scrubs, jackets, or lab coats that are not disposable? Is it recommended that we go to disposable or have a supply of non-disposable jackets to change for each patient and launder at the end of the day? So I think the question is just, is it a time to go to disposable jackets so we can change these out periodically? And what if we're an office that uses scrubs and the same lab coat throughout the day? What's the two things on that? What do you think is the sterilization on that? And then what's the patient perception if they saw another office that was changing coats between every patient and used disposable?
Yeah, and that's where I think the guidelines right now that we've seen from the CDC and the CDA, they're recommending that we move into the surgical gowns, disposable versions. So even if you have your scrubs on, they're recommending to move in that direction and have a surgical gown over the scrubs. As we're going from patient to patient, you're disposing those gowns. So that way we minimize cross-contamination. So that would be my response to that, in the immediate, if that makes sense.
No, it's perfect, and you've given us so much really rock solid information. I really enjoyed it, and I know there's a lot of questions here that they come up, and I respect for the people that come in. We definitely want to see if we can answer as many as we possibly can. There's a few more questions popping up right now, but a little bit similar to what we had. But it's a nice segue because I want to invite you all to reach out to Paul. I have a lot of confidence in Paul. I wouldn't have asked him to come on if I didn't think that his experience and his information isn't really solid. And he's got some great links here, and he's got some information he can share with you. I would definitely email him to get some of the checklists and forms that he's discussing. Paul, we had, close to 400 people on the call today. It was fantastic. We still have a large number left with us. At this point, I want to go ahead and, as we talked about, I want to throw it over to you, and I want to give you about 20 seconds, 30 seconds to give us some parting words of wisdom and some closing information as we close this call out.
For sure, and thanks so much, Jonathan. Very quickly, this question about how much to charge for teledentistry, I mentioned this earlier, that it is very similar to your current UCL on a cash basis for your limited exams and your post-op visits and those kind of things, from what I've seen in terms of that report that I looked at in Southern California. So that's an answer to that question very quickly. And then if insurance companies do, okay, increase fees, can we charge a patient per patient? Well, at any rate, again, I do want to thank everybody for their time this afternoon. Again, I hope that this presentation helped to open up a whole new set of questions for yourselves, so that way, you can go on and make better informed decisions. That's really what I predicated my company around, is I want to help to, really help you guys think about perhaps some of the things that we haven't thought about. For example, a COVID-19 exposure event. What is it specifically we need to be thinking about in response to that sort of an event? That's really what, I'm passionate about, is when I work with my doctors, I really want to sit down and help them see the things that they aren't seeing right now. And I want to thank everybody for their great questions this afternoon. I learned a lot in just thinking about some of these questions. Again, right now, this is a very fluid time. I know it's a tough time mentally for everybody. And if I have any recommendations, any parting thoughts, I would say, let's keep it very positive. Let's re-engage your staff. Let's do everything you can to re-engage with your patients remotely. And know that, we're right around the corner from getting back to at least some phased normalcy, if you will. And, we're all looking forward to that. Again, if anybody has any questions beyond here, feel free to email me, feel free to call me. I'm available and I'm happy to answer any questions. And yeah, this is, again, a great opportunity. Thanks so much, Jonathan.
Awesome, Paul, and I appreciate it. To speak in harmony with what you were saying. Yeah, there's a lot of unknown things going on right now, and the purpose of this venue was, for me, was to bring some communication and some community to a lot of these topics and ideas, and start to formulate, some good opinions of what we're going to do going forward and how we're going to treat these situations. Having great people like you on the calls is definitely what it takes to share your insight and keep us going. Again, Paul's information is there on your screen. It's Paul Yuan, and he's the president and dental consultant with Elite Dental Services. That website is www.elitedental, and then the letter S, the letter V, the letter C.com. And then Paul's email address is yuamp@elitedentalsvc.com. I say that because we're getting a lot of people that are listening to the podcast of these presentations and sharing this information. Paul, on behalf of everyone, I want to thank you. And in my parting words to everyone here is, this has been really special. We had close to 400 people on the call today. Wow, just wow. This started, 4 weeks ago today, and I expected 12 people. We got 70, and it's just grown from there. I appreciate all the thank yous. It does put a lot of information in my inbox, so maybe I'm going to share my Instagram so you guys can share the information there. But, I love this information. I love that we're all coming together and figuring this out. Paul, thank you again. And in closing, I just want to tell you guys that utilize this time for CE and learning, and enjoy the time with your families. I've been locked up with my 2 kids for, 3 or 4 weeks now. It's getting a little tougher every day, but we're still enjoying it and still making the most of it. I want you guys all to come back, share this information with friends. And with that being said, we're going to go ahead and close out the meeting. And thank you all for coming.
All right. Thank you.